Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolff, and we're joined tonight by Dr. Colleen Bridger. And thank you for joining us for our final COVID-19 evening briefing. This is the final 613 briefing, and I'm pleased to announce that we have crossed the 50% threshold for fully vaccinated residents here in San Antonio. Some 50.2%, or 834,258 people have received received both doses or the single dose of the J&J vaccine. A full 1,073,367, or 64.6% of residents have received at least one dose of the vaccine. So we're doing very well in that regard. If you haven't been vaccinated yet, I promise we have enough doses for you, so do it for yourself, do it for your loved ones in your community, do it for San Antonio. We have not reached the end of this pandemic. Hospitalizations and case numbers have improved significantly, but our work continues. Our response and recovery efforts will shift to a more targeted approach, especially as it relates to vaccines, and we have to remain vigilant to ensure that everyone gets vaccinated as quickly as possible. Our local rates of infections and hospitalizations are all proof that we need to demonstrate that, and we have demonstrated that these vaccines work, period. If you haven't been vaccinated, continue to wear a mask and social distance. These briefings, as you know, began over a year ago, March 2020, as a way for us to share the most current information and resources with you as we join together as a community to fight the coronavirus. So as life begins to return to a little bit of normal, I want to thank each and every member of our community for doing your part to fight this pandemic. The sacrifices we have made have not been easy. The lives we have lost will never be forgotten. Our resolve has been tested as San Antonians, but as San Antonio, we are resilient. So let me turn it over now to my colleague through this entire year, someone who I've enjoyed fighting this pandemic with and being part of the team with, and that is Judge Wolff, before I get into the rest of the numbers tonight.
Thanks, Mayor. You know, I was just counting up the months. I think it's been some 17 since we were faced with this beginning of the pandemic, and then some 15 months, I guess, we've done the daily briefing. It's been an extremely difficult time for all of us, and I do want to thank you very much for working with us as we've strived together to put in place various safety measures and that would control the speed of the COVID. As the mayor said, we are past the worst, but the future still has some uncertainty. We don't know how long the vaccine will last. We don't know possible other mutations. We know some people have chosen not to get shots, and it's still continuing to spread in our community, not like it was before, but still people are still getting COVID, and they're still entering the hospital today. There's some things we've learned, and I jotted down just a few of them, and I think it's maybe worthwhile just to kind of review them. I think the most important thing we learned that we had to have accurate and clear communication, and that's what we've been trying to do, but we've relied on health care experts and on data management to come up with the communication that we provided to you, as well as the emergency orders that we put in place. And we've done our best over this time to talk with you and to explain the severity of COVID and the things that we need to work together. It's interesting, there was some work done sometime last year, I think, by Dr. Juan Gutierrez, who's chair of the mathematics department at UTSA, on a study that they did. Had we all not worked together like we did, the cases would have been astronomically much worse than what they were. We've learned that just some common sense precautions really do work. Disinfecting, hand washing, sneezing or coughing in your shirt not only help stop the spread of COVID, but also this year it led to huge reductions in chickenpox, strep throat, flu. For example, flu was down 99%. These are easy things that we can continue to do to protect ourselves against whatever might be out there in terms of a virus. And I think we've learned to care for each other more than we maybe have in the past. All the precautions we took not only protected us, but they protected everybody else. And I really, really appreciate the fact that people have done that. And we've learned how important the development of vaccines is. And so we know now that we have to have more research on vaccines. We've learned how to distribute it, how to get it to people, how to do it in a safe way. And I think that was a very important thing that we learned, and we'd be ready in case something else ever becomes our way. And we do need to prepare for that. Pandemics have been here ever since humans have been here, and pathogens have been here, and so we do know something will come our way, so we need to be ready for it. This time, the federal government needs to pay attention to the early warning signals. It was some 3 months that were wasted before CDC and the federal government kind of woke up and began to take some actions. We need to continue to plow money into the development of vaccines, and locally we need to ensure financial resources for Colleen and Metro Health and the tremendous job that they did. And they're now working in a much closer working relationships with the Bexar County Hospital District, and that needs to build on. We need to do a little better job at the county level, too, of making sure that we have some medical experts to keep our county commissioners court advised as we go along, because we know it's not a if one's going to come, it's a question of when. And we all need to work hard. We need to increase our hospital beds. We were real close several different times to exceeding the capacity that we had. Our Bexar County Hospital District has bought 2 large tracts of land, and hopefully we'll be able to, in the near future, build a couple of more community hospitals. So those are just some of the things we learned and some of the things we did together, and it was a pleasure to work with Mayor Nuremberg. He's provided great exemplary leadership in this effort, and it's challenging time, but I think we all pulled together and did the very, very best that we could possibly do.
Thank you, Judge, and it's my hope that the mantra that we started this pandemic with, which is we're all in this together, remains true and remains in our minds even as we've made this COVID-19 pandemic part of our history. I do want to go into our COVID numbers now. Tonight we're reporting 114 new cases of COVID-19, which brings the total number to 223,012. Our 7-day rolling average now has dropped to 106. Very good news. Our progress and warning indicators remain steady. Our positivity rate remains extremely low at 1.4%. There are 4 new deaths to report tonight, so please, again, remember that we have lost too many of our loved ones, mothers, daughters, fathers, sons, loved ones, colleagues, neighbors. Please keep them and their families in your thoughts and prayers this evening. There are 140 COVID-19 patients in our hospitals tonight. There are 24 new admissions in the last 24 hours, 41 patients in the ICU, and 23 are on ventilators. Now, Dr. Bridger, who has been the coronavirus czar during this pandemic for our community, I'm going to pose to her the frequently asked question, which I'm sure we're going to be getting quite a lot, and it's a very important one, and that is, Dr. Bridger, is the pandemic over?
Unfortunately, the pandemic is not over. We have come a long way, and I think we're out of the crisis aspect of the pandemic. But COVID-19 is still in our community, and we still have, another half of our population to get fully vaccinated against it. So the work continues, but we've just gotten into a different cadence of information going out to the community, and so I think we're just moving into that next phase.
Thank you, Dr. Bridger, for all your work and your team as well for this year. And so again, thank you for all that you've done. I'm talking to you if you're watching the TV or listening on the radio. I look forward to seeing you in person very soon. Before the judge and I close out tonight's briefing, we want to take a moment to acknowledge the many people who have served on the front lines of this response and recovery. Thanks to our Chief Charles Hood and the San Antonio Fire Department, the team at STRAC, led by Eric Epley, University Health, UT Health, and WellMed for bringing mass vaccination sites to our community. I also want to thank the entire city team, the City of San Antonio organization, led by City Manager Eric Walsh. Finally, I do want to recognize the work of San Antonio Metropolitan Health District, again, led by Dr. Colleen Bridger. The team at Metro Health has been working around the clock for more than a year, beginning with the arrival of the repatriated Americans at Lackland Air Force Base. Their work, the steady flow of information, focus on equity, and now distribution of vaccines has been critical to the response and recovery. Let me especially thank the following Metro Health leaders for appearing on these nightly briefings to answer your questions, share insights, and bring our minds to ease. Dr. Junda Wu, Dr. Anita Curian, Dr. Rita Espinoza, Dr. Golare Aga, Mario Martinez, Jennifer Harriet, and of course our Incident Commander, Assistant City Manager Dr. Colleen Bridger, who joins us here tonight. This has been a team effort. I want to thank my colleagues on the City Council as well. We're here today because of the work that all 1.7 million San Antonio residents did to help curb the spread of this disease. So as life starts to feel a little bit more familiar, a very small ask. Beyond the pain and suffering that many of us have endured the last 15 months, I hope that we vividly remember how we came together as a community. If we're able to carry that spirit of togetherness into the years ahead, I'm confident that San Antonio can be the envy of the world as we find our new normal. Again, we started in this together, and we will always be in this together. Judge Wolf?
Yeah, let me thank David Smith, our county manager. He really stood up and did a lot of great things to protect our employees and our facilities. Our Bexar County Office of Emergency Management, the Bexar County Fire Marshal's Office. Sheriff Salazar did a terrific job. We had over 4,000 people in the jail that we had to take extraordinary measures to protect, as well as our deputies in the jail. The Bexar County District Attorney's Office, all of our Bexar County employees, George Hernandez and his team at Bexar County Hospital System, Dr. Ruth Bergman at UT Health Science Center, who worked with us all the way through this. And then to the commissioners that many times came on this show, Commissioner Rodriguez, Commissioner DeBerry, Commissioner Calvert, Commissioner Clay Flores, all came on this show one time or another. So between the city and the county teams, I think we did everything we could possibly do to help overcome this tremendous crisis that we have faced.
And thank you, Judge Wolf. And also, the information flow does not end tonight. Again, the pandemic continues. Get the latest news and information at covid19.sanantonio.gov. We'll now go to questions from the press.
Hey, so heaven forbid this arise again, another pandemic, but just want to know, do you feel secure that you would be prepared if something like this did come up again?
I think we are much better prepared as a nation, seeing what has gone well and what has gone wrong. And certainly San Antonio has been exemplar in the things that we've done to navigate the changing data and the changing circumstances of the coronavirus. So I'm very confident that the infrastructure and people of this community are well prepared to handle the next crisis.
You know, we never were faced with anything like this in our lifetime. I guess you could go back to the flu that was 1917 when they were totally unprepared, but nothing during our lifetime like this. And we know that something can very well come at us again. And I think, going through everything that we've learned and being ready, I think we'll get a jump start on the next one.
I would like to echo what the mayor and judge have said. I think, we did a lot of just-in-time training for this pandemic response, and that has made us stronger and smarter in how we address some of these issues. And so I think, we certainly would not like for it to happen, but were it to happen, we will be in a much better place.
Cases are currently at their lowest level since June of 2020. Do you attribute that to the success of the local vaccination program?
Yes, absolutely. I mean, there's a definite cause and effect relationship. The more people we got vaccinated, the lower the case numbers fell. We're seeing that across the United States. So yes, if there's anybody who has any doubt about the effectiveness of the vaccine, please look at that data and see the cause and effect relationship there. That is our way out of the pandemic.
Can you describe how you'll be putting information out to the community after these updates are done?
Sure. So we are, as I mentioned earlier, we're kind of changing the cadence of our information flow, but essentially we will go from daily reports to weekly reports. So every Wednesday, we will issue the progress and warning indicator report, the vaccination report, and the cases and number of tests done. All of that will be put on the city's website, and we'll, along with the dashboard where you can do whatever you wish to do to analyze the data. But instead of updating it daily, we will now be updating it weekly.
What are the thresholds, and I realize this might be too early to ask, but what are the thresholds that the city and county would need to cross to be out of the pandemic? Is it like 2 weeks with no cases, a few weeks with no deaths? Like when is the pandemic over for Bexar County?
Some of that is still to be determined, Joey. We're working with the CDC to figure out what that looks like. I think the first major milestone that we will hit is when we hit that 70% fully vaccinated. And there are plenty of states who have accomplished that, so we know that's not impossible to do. After that, I think we will start to look at, what is the case rate, what is the hospitalization rate. One of the biggest indicators that we watched during the pandemic was the positivity rate. It's now been 8+ weeks that it's been below 3%. So that one, I think we can check that box. I think the next box will be the 70% fully vaccinated. And then the rest, we'll kind of take our lead from the CDC and from the state.
While we are doing well, I think, in most places all across the nation, we still need to remember there's huge problems around the world yet. In Brazil, there's still a big outbreak of COVID. India's been struggling with it, so it's out there. We don't know what sort of mutations might take place, so it's a dangerous world out there yet.
Mayor Nirenberg, would you be willing to comment on the prostitution payer arrest of former City Councilman Chip Haas?
I don't have any comment on that.
That's all the questions we have tonight. Thank you.